Hello, welcome back to Cancer Val Loves You. This is episode 4, video 4, and I'm going to talk about hair loss after chemotherapy or as a result of your treatment. So it's quite dramatic. It was quite dramatic for me. Everyone's going to have their own experience, but I'm going to explain to you what that experience was so that you'll be able to recognize it and um, be able to adjust to it and be able to bear it, basically. Um, there are going to be some things that you might want to get, all right? Hats, you know, um, wigs. I'm going to talk about all of that in a minute. So for me, the hair loss started after the second chemo or as a result of the second chemo. So it was very gradual at first, and I didn't really anticipate or expect it, but it sort of happened because I wasn't sleeping in my bed. And I was sleeping sort of when I started feeling uncomfortable, which was way back in October, and I was getting all the stomach cramps and everything. I sort of moved away from sleeping on my bed and started sleeping on a mat on the floor or a mattress on the floor. And for me, it was just physically more comfortable and I could rest. I wasn't getting that much sleep, so you might experience some sleep deprivation when you're not exhausted from the chemo. So I don't sleep a lot as it is, but when I'm tired, and that's generally how it works. But on average, I get about 4 or 5 hours of sleep now, which is not a lot, right, compared to most people. But that might not be you. That's just me. And so I was sleeping on this mattress in my living room, which I'm on right now because I haven't quite managed to get back to my bed yet. So I think I'm waiting for all the chemo to finish and for my body to adjust to some level of normalcy, whatever that is. And I had a pillow, and it has a red pillowcase. And the hair loss started because I noticed that the pillowcase was getting covered with hair, and it wasn't the sort of usual hair loss that you see in a brush. It was sort of all over the pillow, and it wasn't big clumps or anything like that, but it was sort of different, right? So that was the first sort of me noticing. And then I noticed that I have carpet here in my place, and so I sort of noticed more hair on the carpet and in the bathroom. My hair, right? So I'm competing with my dog here, who has a whole bunch of his own hair. But at this point, I was shedding, all right. And then the next stage of that, so after about a couple of weeks, this um, changed to actual me touching my scalp, and the hair would sort of come off in my hands. And that was freaky, all right? So I had very long hair, and so it was totally surreal and unexpected and odd and scary and all of that stuff. At the same time, I was losing hair on my body. Okay, that I wasn't even noticing. Like, I lost the hair on my eyebrows. There's still a few little shards hair left. But wherever a woman has hair, or a person going through chemo has hair, that's going to be slowly leaving your body. So on the head, which was my main focal point because I had so much hair, right? It was coming out in sort of clumps, and when I brushed my hair or combed my hair, whatever I was, however I was grooming myself on the head, it would come out in big clumps, which I would throw into the toilet and flush. It was just that radical, of hair loss. And it was coming, it would come out to a point and then it would stop. And then my hair started to look thinner, right? Because I had very thick hair. And it got to a point where I needed to do something because it was starting to be really messy. There was hair everywhere, and it was not really manageable hair loss. It was sort of unexpected and unanticipated. So it was still long in places. So I decided at that point it was too much for me. You will get to that point if you happen to go through this experience, of knowing when it's just icky. Really, that's the only word I can think of to describe it. It's not fun. So anyway, so I dashed off to the local supercuts, and I proceeded to get my head shaved. All right, and it was long enough at that point where there was enough hair, and I had done this in previous years where I could donate the hair to someone, to a company, and they would make a cancer wig. So I made sure that I had whatever it was, the 11 inches in length, and enough of it because it was thick, um, to donate my hair, which was something nice that I could do. And if you can do it, great. If you can't, it's okay. Don't worry about it. So the lady from Supercuts was very nice, very understanding. And I was a basket case, to be honest, because this was yet another unexpected thing. And it was a kind of a gloomy February day, and or March, whenever it was, and it was I was resisting going, but I knew I had to go, right? There are people that voluntarily shave their heads, but I wasn't one of those people. I was kicking and screaming mentally all the way to Supercuts. So, but the lady was super nice, and Supercuts super nice. I don't know, and she chatted with me. I think her name was Jessica, and she was empathetic, and she talked about her grandma or some relative who had cancer, and I was asking questions. Do people come in and do this a lot? And how much should they take off? And should I shave it all the way? And all of those unanswered questions in my head, that nobody could answer really, because everybody has their own experience, right? So Jessica proceeded to get the shears and adjust it, and I said, "Does it hurt?" And she said, "No, we adjust the blades. Um, if you feel uncomfortable, let me know." Um, but it was really just very gentle, and it took no more than 5 minutes to shave off after she had cut off the stuff for the hair for the wig. What was left was minimal, right? So um, she shaved the rest, and I'm sitting there feeling horrified. I just felt horrified that I was losing my hair in such a dramatic way. And I've had long hair ever since I can remember, ever since 13, I don't know. So a long, long time of loving my long hair, and losing it all in a minute. It felt like. So so she shaved it all off, and she touched it up, whatever they do, and it was done, right? So I left there and I had a hat, all right? So if you don't have hats, get hats and get a combination of like slightly woolen hats and cotton hats because your scalp's going to get cold, all right? You're going to feel cold in the scalp area. It's kind of a, I'm going to take off my hat in a minute and show you, but I don't really want to, but I'm going to do it for you. But um, your scalp's gonna feel cold, you know, and you're gonna want to cover your head because for me personally, I was a bit embarrassed not to have hair. So it was nothing that I was used to, and the hat really helped um, on multiple levels, right? It kept my head warm, it kept me feeling less embarrassed, and you know, it was fine. And then, you know, I took a picture and or I showed my friend when I was with her, yeah, because I really wasn't going to take any pictures. I didn't want anybody posting stuff with my head like that. And so, and she said, "Oh, you have a very nice scalp. You know, it's all even all over. There are no like bumps." And I'm like, "Oh, great." You know, that's what was my reaction. But you know, it is what it is, and you know, several months later, I'm sort of used to it, and I sort of like it in a way. Um, Not having hair on your body is sort of for a woman who has to shave everywhere, armpits, legs, all of that stuff, all of the shedding and you know clearing up of the hair and all of that stuff, all of that goes away. You know, all I'm now I'm just competing with the dog, and the dog has more hair than I do, so so I can manage his hair. I don't have to manage my hair as well. So that's kind of a funny thing, but a small funny thing. So here it goes. I'm going to show you my shaved scalp. It's going to be quick. All right. So here it is. All right. Right. All right. And then just to explain a little bit about the scalp, at the back, there's going to be like a soft, spongy bit. All right. And then on top, you're going to have the hair, you know, pretending to start to regrow. You're going to feel a little fuzzy stuff up here, but it's not going to grow while you're doing the chemo. It's not. Um, and there's going to be ridges in the back that are sort of soft. All right. So these are the things that hopefully everybody has the same scalp. I don't know, but you're going to be able to, you know, have this sort of experience. I remember the first Star Wars movie that went to the theater. One of the actresses who was on deck with Captain Kirk, she was a tall, elegant, I think she was an Indian woman, and they gave her a shaved scalp, and she looked beautiful, and she was famous for it. So, you know what? I'm just going to go with that. Oh, I should keep my hat off because I'm going to show you a couple of wigs next, but we'll get to that in a minute. So, you might need a couple of wigs as well. All right. So, I just went on Amazon and I tried to buy one that was close enough to my old hairstyle. You know, I know that sounds weird, but I just wanted to feel semi-normal. Of course, you're not because it's a wig. It's not your hair. You're not used to it. And you're not going to be wearing it that often, I don't think, unless you're going to work every day while you're going through treatment. So, this is, I'm going to show you the wig that I got from Amazon. And what you're going to need is a little cap, all right? So you put the cap on. I'll take my hat off. And you have the little cap. And what happens is the wig attaches to the cap, all right? And it doesn't have to be a fancy cap. They sell them on Amazon. And I got one with the wig, all right? So I think this is the one that I bought, and this is the one that came with the wig. And they're sort of tight a little bit, all right? So they fit very comfortably on the bare scalp. And what they do is they give you a cushion for the wig, all right? So this is the wig that I got. Now I'm going to put it on, I'm going to mess it up, and it's going to look funky and weird. But what I do is I brush I brush it out. And then it's got these little clip thingies on it. And the clip thingies are to attach to the little cap. All right, and you can use what are those things? Bobby pins to keep the wig in place, and it pretty much stays in place. It's not going to go anywhere. It's got little clippy bits, if you can see at the back too. All right, and then basically what you do is you just put it on. I'm going to look horrible, all right? So because you have to really play with it to make it look normal. So so here we go. Oop, sorry. Do this again. As I make a muck up of the wig thing, right? So, and you want the little cap to be hidden, right? And then you just kind of play with it. And then you comb it into place. So I look like a horrible, wicked witch. But you know, you get the idea, right? Just tidy it up a bit, right? And then the little clippy bits sort of clip onto the hat. And then you play with it and make it look as normal as possible. And this is synthetic hair, all right? So you can't use an iron or hair dryer or anything like that because it's synthetic and you'll melt it. So you can get real wigs. They're super expensive, but I just want, this was like $19 or something like that. So I wanted something quick and expedient, and something that I could, you know, tolerate myself in, basically. So this is this one, all right? So that's this wig. So I'm gonna take this off, and I'm gonna I'll take the cap off, all right? And then and then the other option I got, which my friend steered me towards, this is the Cancer Society. And what the Cancer Society does is they give you a free wig, all right, which is a very nice service. It's a recycled wig, which they clean and they repackage and everything, and then they help you fit it, and they show you how to put it on, all right, which is a really nice service. So, but they don't take you until your head's shaved, and the reason that's necessary is so that they can give you a wig that's going to fit properly, all right? So once you get to the stage where, you know, you're done with your hair because you can't manage it anymore, then make the call to the Cancer Society in your area and make an appointment, all right? And they've got lots of wigs, all right, so you can pick. So that's where I got my second wig from, all right? So this one, it is sort of a little fuddy-duddy style. It's, you know, of the two choices, I picked the one I got from Amazon because that's most like my old hairstyle and makes me feel most normal. But, you know, I have the other one as well. So when there's if I have to go to work, a staff meeting online, or something where I need to feel better, that's what the wigs are for, all right? So that's all about wigs. So just, it's okay. It's gonna grow back, right? Once all the adverse chemicals that are in your body fighting your cancer start leaving your body, you know, and you start getting bacteria back, your natural bacteria, your hair will grow back. It'll grow back, I've heard, differently. So not too differently, but it won't be, it might be even be better. You might have nicer hair. So I'm signing off now before I ramble on. And Cancer Val loves you and wishes you well. See you next time.